Evening, folks. Welcome to Tourniquet Talks with the Ghost. We're going to talk about two tourniquets here. These are the ones that I really like the most. We have the TMT, which is Tactical Mechanical Tourniquet. This one is from Combat Medical. And we're also going to be talking about the X8T tourniquet. This one is from RCR Medical. Let's start with the Tactical Mechanical TMT. Once we get it opened up here, as you can see, this tourniquet also comes with a little instruction pamphlet, which is great for those folks who have not actually worked with tourniquets before. It teaches you how to put the tourniquet on, talks about the different things, and also gives you the instructions for a 9-line. So let's kind of talk about this tourniquet here. As you can see, the way it is stowed, and it also has a lot number on it. So for those people who are buying in bulk, you can actually see and call the company, and they will make sure that if you have tourniquets and things like that that have been on the shelf for a while, that this is actually one of the ones that are still good to go. If you've had them for too long, things like that. If it's been in extreme heat, extreme colds, and all those kinds of things. So once we open this tourniquet up, let's look at the characteristics of this tourniquet. One of the things that I like is the fact that it has this nice hard plastic piece right here, so that when you are getting ready to put that over your vessels, you have a nice wide band going on. Also, when you look at their windlass has a larger piece towards the center, it gets smaller, but also one of the things that you may not note is that when they do the code test for this tourniquet, unlike some others, if you put this tourniquet in the freezer and then throw it down on the ground, it will actually not break and this windlass will still be good to go. Also note how the band is wide all the way around, and that's a really good thing for us. The other thing that we note is, look at the buckle here. So if you need to slip this underneath a large limb or something like that, you actually have a really good buckle. They've also placed a pillow here. So one of the things that you can't do is to pull this completely out like some of the other tourniquets have done, and when your hands get bloody and slippery, you actually have something to hold on to pull. That's one of the other great features of this tourniquet. Also, if you note, they have a material here, so if you've been training with this tourniquet and when you look on the back there, you'll see that if you continue to twist, what'll start to happen is you will get a white material that will show up. And so that's one of those things that can be used for, if you're doing an inspection on any of your personnel, if you're getting, PCIs, pre-combat inspections, things like that. And so you can check to see if someone needs to get a new tourniquet or not. What I like about it is the fact that, like we've talked about before, once you put this tourniquet on, it's very easy. You can pull all of that slack out with that ratcheting motion. Once you get all the slack out, right, because of the way that they have the tourniquet designed, you can pull it all out. You can see that it stays in place, nothing comes loose. And as you start to twist till the bright red bleeding stops, if you listen for a second, you get a loud click based on the keeper, and that lets you know that it is in there. Then you can take the rest of that, as we want to do so it doesn't get snagged or anything, and actually stow it away. So this is one of the great features of this tourniquet, and I really do like it. Now we're going to take this one off. Now once you get this off, right, what I do like about it is they also teach you how to store it properly again. So if you take it and you put it basically like a finger or two just before the pull, and you make sure that everything is all lined up, right? You take that and you put it off to the side. You take your windlass and you put it off to the side. Now, if you wrap around, you basically get your tourniquet back to the proper position that you usually have it. And as you can see, it's also one of the tourniquets that I wear, also in line with my pistol, and we'll talk about that one on a different tourniquet talk. So let's go to the X8T. Same type of deal here. Comes with a nice group of instructions. basically so that it teaches you how. And one of the great things about this tourniquet is it is also in multiple different languages. And so I like that, because if you work in any austere environments or you're trying to teach other people, this actually gives you how to put the tourniquet on in multiple different languages. So now let's look at the XAT. I've always loved that these tourniquets come with these great bands. And one of the reasons I like to hold on to these bands, again, if you think about how I'm wearing this tourniquet here, you can take those bands and you can use them to strap your tourniquet in. So this version, so again, I like the way they have it done. They have a large section here so that you can basically put the tourniquet on. Unlike the other one, it doesn't really have such the wide width, but also a very good tourniquet. I like the fact that it also comes with a nice buckle, so that if you need to go around larger limbs, just a different version from the other tourniquet. And then also what you have here is the ability to pull the slack out and also have something to grab onto. The piece that I really like about this tourniquet is the fact of how they have their windlass. And so what you'll see is it actually has a mechanism with these little teeth inside of it. And so when you turn, it tightens up your windlass and it makes it easier for you because it catches as it turns, and so it doesn't have that ability to come back off. And we'll show you that. So same thing, you want to take your tourniquet, and as you put it on and you pull all that slack out, and you notice how the way the band is here, it pulls all of that slack out and you don't have any resistance whatsoever. So now when I get ready to turn the windlass, which is this ratcheting system that actually has teeth, you can hear that click, and as you twist to the bright red breathing stops, you don't have a stow keeper. You don't have to worry about if you put it in the right spot. In some places, if you actually had a windlass that had the triangle or something like that and it didn't go, right now I can really feel that this is ratcheting on. And so that's really what I like about this version. Now you do have a longer tail. It does have some places for you to get the rest of this lineage out of your way. But again, a very good tourniquet. I really like this one for the lay person who hasn't really done a lot of training or real life issues where someone was bleeding and they needed to put a tourniquet on, because let's face it, there are very different times where people think that a tourniquet is really easy to put on until you actually had to do it. And we talk about that during my Stop the Bleed classes and our hemorrhage control classes. So to take this one off, and we're not talking about, you know, as you're transitioning a tourniquet, I'm just showing you for this class, right? You have to lift up, which is the part that makes it a little bit difficult in your training. Wow, I'm getting that blood back again, right? And you can see that those teeth have come off, and then you can also undo that buckle. The stow, this one again, I would always recommend if you are checking your tourniquets, making sure that they are still working in their proper conditions and things like that. Same thing, you want to pull to make sure you have enough tail on that tourniquet, and then you want to take it and basically wrap it, and then your tourniquet is back the way it was originally set. That's Tourniquet Talks for today. Stay tuned for more Tourniquet Talks with the Ghost.